Hearing is one of our most critical senses and is required for connecting to people and interacting with the world. It is the foundation of many different aspects of a healthy lifestyle by enabling everyday communication. Individuals with profound hearing loss are deprived of this essential sense, hampering their quality of life, especially children, in whom lack of hearing can hinder development of speech and language, reading skills, and cognitive functions and lead to emotional difficulties. Advent of cochlear implants has revolutionized rehabilitation of individuals with severe to profound hearing loss, having the most impact in prelingual deaf children. The history of cochlear implant development was anything but a smooth one and dates back 2 centuries, starting from 1790 when Alessandro Volta experimented with passing electric current in the auditory nerve by placing metal rods in his ears. The first single channel implant, which could be surgically implanted, was developed by Dr. William House in the 1960s. This initial cochlear implant could provide auditory sensation and basic frequency discrimination. The persistence of pioneers in this field has provided the foundation for today's modern devices. Last few decades have seen continued research, and the modern CI technology has progressed with leaps and bounds. Cochlear implants and their use have become a standard of care across the globe. From speech perception to music appreciation and discerning speech in loud environments, CI research has continued to surprise researchers, clinicians, and patients. Today, we have cochlear implants with thinnest possible electrodes, which are atraumatically placed in the cochlea for not only auditory sensation and speech discrimination, but also music appreciation. A CI converts sound into an electrical current that stimulates the auditory nerve and produces the sensation of sound for the recipient. The mechanical function of the ear is bypassed as the signal directly reaches the auditory nerve. A CI consists of external and internal parts. Microphone, speech processor, and transmitting coil are located externally. The receiver stimulator is implanted in the mastoid bone behind the ear, and the electrode array is implanted into the cochlea. The device is switched on in the post-operative period, programmed, and the recipient undergoes training and rehabilitation to learn to use auditory cues obtained from the device. Cochlear implantation leads to significant and rapid improvement in speech perception and speech production, and more gradual but progressive improvement in complex language and grammar in most cases. Not falling behind, India has been at par in the cochlear implant journey. In India, Dr. Sandra D'Souza performed the first 5 cochlear implantations way back in 1987. Her contemporaries, Dr. Kirtane, Dr. H.M. Hans, and Dr. Mohan, have become key figures in this field. As always, AFMS has been in the vanguard of this revolutionary surgery and was one of the first organizations in the country to establish a cochlear implant center way back in 1997 at Armed Forces Medical College, Pune. The first cochlear implantation in AFMS was performed on 1st November 1997 at AFMC by the then Surgeon Commander, later Surgeon Vice Admiral V.K. Singh, assisted by Colonel Ravi Kumar on a 35-year-old Rajbir. Pediatric cochlear implants received FDA approval in 1990, and at AFMS, we were not far behind. The first pediatric cochlear implantation was performed on 10th June 1999 on Anushi, a 5-year-old girl. Since then, the journey of implantation continued to grow in numbers as years passed by and resulted in many successful stories. One standout story among our implantees is Diksha Dagar, who had bilateral profound hearing loss since birth and underwent cochlear implantation at the age of 4 years on 17th August 2005 by the then Surgeon Commander Dilip Raghavan. The cochlear implantation, followed by hearing rehabilitation, has aided her normal cognitive development. She later went on to pursue golf, representing India at various international levels, and became the youngest Indian to win the Ladies European Tour.
Without hearing problem, you will face a lot of challenge. I'm so fortunate to have cochlear implant.
She was awarded the prestigious Arjuna Award for her achievements in January 2024. Many such success stories illustrate the tremendous positive impact cochlear implantation has on the development of hearing impaired child. The implantation program in AFMS has since then grown with the establishment of multiple cochlear implant centers at Army Hospital RNR, INHS Ashwini Mumbai, Command Hospital Air Force Bangalore, and the latest being Command Hospital Eastern Command Kolkata in 2016, providing seamless services to the combatants and their dependents across the country, and helping children navigate the journey from silence to sound. The journey of enabling hearing via cochlear implants is not a straightforward one and requires speech and hearing rehabilitation before and after the implantation, which is vital in achieving hearing and speech. To provide comprehensive care and rehabilitation, state-of-the-art rehabilitation centers have been established in all AFMS cochlear implant centers. These centers have been installed with the latest equipment and have dedicated audiologists and speech therapists who are instrumental in the rehabilitation journey of the implantants. So far, the cochlear implantation program in AFMS has crossed the landmark of 1,000 cochlear implants till date and transformed the lives of hearing impaired children. The AFMS is not only initiating them in this journey, but providing continued hand-holding throughout the years by providing speech processor upgrade and troubleshooting issues. Most recently, we have embarked on the journey of bilateral simultaneous cochlear implants, with most recent policy having provision of bilateral implants in selected cases for improving the speech development skills. In a landmark development, auditory brainstem implantation has been started at Army Hospital RNR for people who are either born without auditory nerves or have non-functional auditory nerves due to conditions like neurofibromatosis type 2 or in certain inner ear malformations such as cochlear aplasia or ossified cochlea when cochlear implants are not effective. An auditory brainstem implant can directly stimulate the brainstem, providing environmental sound detection and auditory awareness, offering the only surgical option for hearing. We resolve to give our best in this journey of transforming lives of the hearing impaired by enabling them to lead a normal life, continuing to put smiles on innocent little faces and bringing joy to their families. With Universal Newborn Hearing Program in place since 2013, we in the AFMS are striving to tackle this invisible disability at the earliest possible age to improve speech and language outcomes. When the Western world is inching towards a goal to reach 1, 2, 3 benchmark, that is, identification by 1 month, diagnosis by 2 months, and intervention by 3 months, we in the AFMS will persevere in this journey and strive to achieve this yardstick and continue our journey to eliminate the sound of silence in the lives of children who are born without this beautiful human sense, which connects them to the world around.